First up at 6 o'clock tonight, more concern tonight about vaccine hesitancy all around Indiana, particularly in the Indianapolis area and among minorities.
And here's why that concern is now growing. This past weekend, the multilingual registration hotline was meant to connect people who have not been vaccinated, especially minorities, to the COVID vaccine. More languages were added and volunteers turned out. But over 8 hours, only about 50 people called in compared to 800 at a similar event back in March. This is an example of vaccine hesitancy continuing as the city of Indianapolis moves to ease up on COVID restrictions. WRTV's Megan Sanctorum looks deeper into this issue, exploring what can be done to increase trust in the vaccine.
Health leaders are still facing an uphill battle when it comes to vaccine hesitancy, and they're finding incentives and education may not be enough to convince certain populations to roll up their sleeve.
I do want to keep ourselves, safe and everybody else, but I am still, hesitant on it.
Bronte Callett is just one of many in the Black community who say they're not ready to get a COVID-19 shot.
So I'm just like, I'm kind of like, should I or should I not? What if anything happens down in the long run or something? And, we can't do anything about it.
On Friday, we were there as health leaders went door to door in Hawville, sharing information about the vaccine and a weekend pop-up clinic that would be happening in the neighborhood. They were prepared for 200 people to get vaccinated. Only 19 showed up.
Unfortunately, we found ourselves, because of our history here and because of systemic racism, there has been a lot of harm done. And so to repair that trust and to repair the harm that has been done, it's going to take time.
Brittany Crone works out of the Christamore House in Hawville doing health outreach work. She also thinks more specific education could help encourage some to get vaccinated.
Educating how vaccines are created, what it's actually doing in the body, because otherwise there's a lot of room for misinformation.
Tony Mason with the Indianapolis Urban League echoed that.
Some are still reluctant. A lot of that is based on history. And, that's something we can't change, unfortunately. The history and the worries and concerns around that are very real, sadly.
He says the temporary pause of the Johnson & Johnson vaccine didn't help either.
That was an unfortunate moment because in some ways it gave credence or validation to some fears or worries.
Right now, according to the state's website, 6.2% of vaccinations in Indiana have gone to Black or African American community members. They make up 9.6% of the state's population.
It's not surprising and it's disappointing because the reality of it is we know that African Americans have been disproportionately impacted by the COVID-19 virus. And so my hope is, again, that as many of us continue with our outreach efforts, and as many of us lean in and to talk about how we've been vaccinated and how we're okay, and it was a good thing to do, and it wasn't painful. Hopefully that will help encourage people.
I just want to, check more into it before I just kind of jump into it.
Working for you, Megan Sanctorum, WRTV.
One way the state said they would be working to combat vaccine hesitancy was by filming minority community leaders as they got their shot and having them share why they chose to get vaccinated. We followed up with the State Department of Health to see how that effort is going. They have a handful of videos posted online and say they are working to create more. We will put a link to them in this story on our website at WRTV.com.